Good morning, guys, and welcome once again to this channel. Today, we are going to look at another set of nursing diagnosis that's commonly used in nursing practice, and this seems to be the most commonest because each and every patient or health worker in the facility is likely to be at risk for this particular nursing diagnosis, right? So, in NANDA, this is under the domain 11, safety and protection, right? And then the nursing diagnosis is risk for infection. Risk for infection. So let's look at the definition. So risk for infection is actually defined here as being vulnerable to invasion and multiplication of pathogenic organisms. So pathogenic organisms are the disease causing microorganisms or agents. And then these agents has the ability to compromise health. So that is just the definition of this nursing diagnosis. All right. So now that we know our problematic side of the nursing diagnosis, with the nursing diagnosis, we have the problem side and then the cause side. So the risk for infection is the problem side, and then the related factor will be the cause of that particular problem. So now that we know the problematic side, which is risk for infection, now let's look at a generalized risk factors that can bring about this diagnosis. So we have one being chronic illness such as diabetes mellitus, then inadequate vaccination, insufficient knowledge to avoid exposure to pathogens, invasive procedures, malnutrition, and obesity. These are technically not the direct related factors, which are the causative factors. We'll get there, but this is just to throw more light on situation in which people can be predisposed to infection leading to this nursing diagnosis. All right, so now let's look at some direct related factors, which are the causative aspect of the nursing diagnosis. So we have a broad heading, which is inadequate primary defenses, right? So under the inadequate primary defenses, you can relate your infection, risk for infection to alteration in peristalsis. So some changes in peristalsis can actually cause stasis of food substances within the GIT, which can actually breed infection since they are not being eliminated, right? So we have alteration in pH of secretion, we have alteration in skin integrity, decrease in ciliary action, premature rupture of amniotic membrane, prolonged rupture of amniotic membrane, smoking, then the last being stasis of body fluids. So this can also be a direct related factors which you are not just going to put them there, but you are supposed to specify exactly the section where these changes are occurring or these alterations are occurring. We have our second broad heading being inadequate secondary defenses. Now that this area, you can have your related factors as decrease in hemoglobin, then immunosuppression, leukopenia, suppressed inflammatory responses, inadequate vaccination, then we have increased environmental exposure to pathogens. Then the seventh one being exposure to disease outbreaks. So these are all direct related factors you can work with when you want to have your full nursing diagnosis set for risks for infection, right? All you have to do is know how to put it, and then we have some few examples ahead which you could use. So you can actually see the original literature where I derived this information from www.nanda.org. All right, so now that we know our problematic side of the nursing diagnosis, which is risk for infection, and then we've seen the various related aspects or factors. Let's look at how you put your patient problem on the nursing care plan sheet. So your problem could be or is patient is prone to infection. This is a simple one, alright, but there's a way to put this to be more exciting. But writing this is also not bad, it's accepted. So the patient problem right now is patient is prone to infection. Great. Alright, now that we know our patient problem, let's look at some few corresponding strengths that can be used. And these strengths, you have to do your assessment to see the strength the patient possesses after you've found out that the problem is that patient is prone to infection. So under some few sections, let's look at them. You have cognitive abilities. So here you can have your patient strength being patient can verbalize the signs of infection, or patient is ready to learn about preventative hygiene. Right, so this is the case where by your assessment, the reason why the patient is prone to infection is because of maybe the patient probably doesn't know much about hygiene. Do you get it? So meaning at the hospital, patient doesn't wash his hand before eating, patient probably doesn't wash the plate clear before putting food inside for consumption. So at this moment in time, that is a nice strength for that particular person. And then we have physical capacity. So we have patients can independently perform or can be assisted with proper hand washing and then personal hygiene. So probably the patient is very ill and then still has the ability to do some um, hand hygiene, or can be assisted to perform hand hygiene prior to eating. Do you get it? Then we have cooperation. So your patient is willing to cooperate with sterile dressing changes or maintain a prescribed infection conscious diet. So at the cooperation side, this is for maybe patients who are prone to infection because they have break in skin integrity, they have a wound somewhere, right? So this strength is normally good for them, right? So either they are willing to cooperate with dressing, which helps prevent infection of the wound, right? Or they are good or ready to consume diets that can help and promote wound healing, right? And then we have social support. Patient has an engaged or helpful family available to assist with care and maintain a clean environment. So this social support when the patient is actually in the house. And then technically, if you see the patient, will come up with a nursing diagnosis like risk for infection. But the strength for the patient at that point being prone to infection is that the family can help maintain a more good environment for the patient to actually recover, right? So these are the available strengths that you can explore when writing a care plan for the patient. So the thing is that you have to do your assessment to know which of the strengths the patient possesses depending on what you've seen to be a predisposing factor to infection, right, to the patient. All right, so let's take example so that we know what we are doing. So this is the real deal. So you have your care plan sheet, the front page. You have patient problem. So the patient you were assigned to was having a urinary catheter in situ. So technically, you can easily get your patient problem. The patient is prone to urethral infection. This is specific because you are actually talking about the catheter. So you due to what catheter in situ, making it more clear for the examiner, right? So what is your strength for the patient? So per your assessment, the strength we had is patient is willing for urethral catheter to be cared for. So patient can tolerate catheter care. It's also a good one if you can write that as well. So that's a typical example of how you write a patient problem, a patient strength for this type of patient problem, right? And then another one can be patient is prone to infection. Why? Due to a wound on his or her left thigh. That is a good one. So what will be the explain? Patient can assume a comfortable position for wound dressing to be done. That is perfect. Or patient can tolerate wound dressing. It's also not bad. So this is very simple. You just have to be creative enough and use the right words to get your thing done. Yours is to look at the patient and then look at the problem at hand. Even aside this, even there is a cannula in situ. You can easily use that as a patient problem and get the strength for it. You get it. So you have to be smart. That's great. So with this, let's look at the tabular form. But this time I didn't put in table because I want to make it look like an assessment. We've done the table severally. So right now you should be used to the table. So technically you have your first set. You write your time and date which you come up with your nursing problem. So now you go to the next set, which is the nursing diagnosis. So you write your nursing diagnosis over there, which is risk for infection related to urinary catheter in situ, right? So the patient is at risk for infection because of there is a urinary catheter actually being insected. Are we okay? So now you go to your next, which is objective stroke outcome criteria. So patient will remain free from infection throughout the period of hospitalization as evidenced by, so one, nurse observe absence of redness and swelling around patient urethral meatus, right? The nurse observe absence of prurient urinary drainages. Then you move to your next step, which is the nursing orders. So this is simple. You can reassure patients as one of them. Then you can now assess and observe urethral orifice for signs of infection. That's another one. Then you can care for patient urethral catheter aseptically. You can record urine output. Then you can administer prescribe prophylactic antibiotics. So your assignment here is to find additional nursing orders and then write your own nursing intervention and then evaluate this work. Alright, so let's look at the last example, which is risks for infection related to breaking the continuity of the skin, which is wound at the thigh. Very simple. So your outcome and then objective will be patients wound remain free from infection throughout a period of hospitalization as evidenced by nurse observed patient wound looks clean and healing, and nurse observed absence of unusual wound drainages. Right. So this type is normally used at the surgical unit or trauma. That's very fine enough. Your nursing orders are reassure patient and relative of competent nursing care, and then you can assess wound for signs of infection, dress wound aseptically, self-prescribed diet, high in protein and vitamin to promote healing. Then you can administer prescribed antibiotics as well as prophylactics. And then you can monitor vital signs, especially temperature. You are good. So your assignment here is to get more nursing orders as well as find your own nursing intervention and then you evaluate. Alright, thank you for your time. God bless you. Don't forget to like, share, comment, and then subscribe. See you next time.